which is approved in Ireland or other European unions like UK and New Zealand, not in India. India we don't have such courses affiliated with the council. So you will be able to practice only in European Union. Yeah. 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 In fact, practical settings, no much. Yeah, that is a fact. Because in India, if you see almost all the hospitals, they have electronic system for documentation. In India and GCC, I worked in India for 5 years in Middle East. And there we never use any purpose. There are no paperwork. But if you see Ireland and UK, New Zealand, still they are like 20 or 25 years back in our culture in terms of nursing care. And they don't have any electronic system for documentation, which is still in purpose. That is the thing, and you need to practice again to write up. And you need to write it fast and twice and Roman, so you need more practice in fact. That is one difference. And second thing is in India usually we are not talking to the patient much, but here they are expecting you to talk a lot to your patient. And they are very cooperative. So in that sense, yeah, that is only difference in technology wise. Otherwise, in India, that is actually one of the kind, yeah.
Which aspect we are lacking?
Yeah, in India we are lacking. So I don't think that we are giving more importance in documentation. Documentation is lacking in India. We are simply, for example, I know that's a practice, checking, documenting vital signs, especially like temperature without checking, and people are commonly, just. Yeah.
Actually, the empathy and sympathy, we have to follow here, and ethical aspects also we have to follow here.
Yes.
As we have many patients here. When we have many patients, so we are adequate patient population we have.
Yeah.
So we are teaching here, but and we are not concentrating on the paperwork. It has to be teaching itself, teaching methodology itself, right?
There at the time you studied here, but still you have volunteered to come and share your views and the process to the students, and thank you so much for coming all the way. Okay. Telling about salary and other things. Now, can you please explain the students if they come with a GNM degree or a BSc degree, what is the basic salary they may receive over there, so that they will get an idea, no?
Yeah, I can explain that. The thing is that for GNM and BSc nursing, the salary is not based on the qualification. It is absolutely based on the years of experience which they have. And so, if a GNM nurse is coming with valid IELTS or OET and aptitude skill test, same like a BSc nurse, the salary will be same for both. There are no differences in the qualification. Once you came here and you can add your qualification by doing additional courses. And there are no particular criteria that only GNM nurse can join this particular course, only BSc can join this particular course. Nothing like that in Europe. Everybody will be equally treated. The salary will be equally distributed to both based on your actual experience. They will consider your experience. So the basic salary for 2 years experience nurses, minimum as compared to in India, it will be like minimum 3 to 3.5 lakhs in India.
Nice, it's nice. Okay.
Yeah.
But this is the doubt usually the GNM and BSc students will have as soon as they complete, whether there will be any salary difference based on their qualification. That's one thing. Another one, another thing about this impact of cultural differences when you are taking care of those patients, okay, in different settings and different countries. So in this regard, what advice would you like to give to our juniors?
Well, that is what. Actually, it's a very good question because cultural difference is still the classroom training is also very useful. And the main highlight was that is what I think you people are lucky because you have a college with all hospital, which is very important. Interview. I was able to attend well because my exposure when I was a student was good because I used to be appointed at the ICU of Abirami Hospital, which rarely people will get a chance during student period because Saigon has one hospital, so you will have all the freedom to practice, to observe, to get a good exposure. I think I worked the last 3 to 4 months in Operation Theatre itself. My experience was great. Even I started circulating along with a respected chairman, Samir sir, I do remember. Very supportive. These people were very supportive. Kuttavi ma'am, being a student, their effort, their willingness to teach us was exemplary actually. So those things helped us a lot when we graduated from the hospital. Almost all of us got an opportunity to work good hospitals. We were able to attend the interviews successfully because of these matters. So your option to study Abirami College of Nursing was excellent because hospital has its own hospital. Sorry, college has own hospital with multi-specialty wing, so which is good actually. So that is what professionally, the studies in Abirami College of Nursing, it was actually great. I think in that matter, it will also help.